Hello from One Cancer Place. We are here with our pivoting offering with Dr. Sam Siegel. She's Sam to everyone who knows her. Sam's an internist at Kaiser Permanente. She has survived relapse refractory Hodgkin's lymphoma, including an ABMT in 2022. This made her passionate about cancer survivorship, integrative medicine, and personal narrative impacting the illness experience. So, Sam, we would love to hear your story, and please go ahead.
Yeah, I'm so excited to be here with you guys today. And every time I tell the story, I feel like it changes a little bit, even though all the versions are true. But it's just sort of like where I'm at in the process of everything. And I just like to start off by every time when I tell my story by saying that I know that I am just one voice in this cancer experience. I feel like I have special privilege to use my voice as a doctor patient. And I think that it's important for me to talk about the times when I struggled really hard. Because I see those times now as opportunities for improvement in the cancer care experience for everybody. And so I just hope that by talking about what I went through, what I'm continuing to go through in survivorship, what my friends have gone through, that it makes it hurt a little bit less for people, and that we can live more fully regardless of remission status, age, or stage. So that's kind of the intro. And so, yeah, it's funny because now I process it differently few years later than when I first got diagnosed. But back in 2021, probably around February, I felt like I was minding my own business in life, working very hard as a doctor, internal medicine, primary care. And my husband's also a physician. He's a pediatrician, and we have 3 kids. And we were already deep in the pandemic, so things were hard but good. I had already gone through so much in my life. I feel like I've lived 10 lives by time this diagnosis happened for me. But I was just saying earlier that I was born in Miami, grew up in Southern California. Landed in San Francisco, met my other half before med school. He's also named Sam. And so we're Sam squared. And we went to medical school together. And Sam had a couple serious health conditions, even well before I became sick. He had testicular cancer in medical school. And he had something called primary sclerosing cholangitis, which is an autoimmune liver condition. And ulcerative colitis. The two actually are kind of linked genetically. And so there was a lot that we were dealing with for his health. And it was kind of always about, what's going on with him and what do we need to do for his care. And I was healthy as a horse in my life. And boy, did I take that for granted. But I was kind of this marathon runner and just go, go, go. And so we had already overcome so much. My husband had a liver transplant in 2016, living donor from his younger brother, my brother-in-law, amazing, during his 4th year of medical school. And so I was a caregiver and had been through the experience of just feeling rocked by caregiving and multiple brushes with death as he was leading up to transplant. And after all we had been through and a number of complications and subsequent medical things after his liver transplant, things finally started calming down for us around the first year of the pandemic. So it was like things finally stopped happening with him, and he was like steadily out of the hospital, back to work, and things were starting to develop a cadence in our life, like going to farmers markets and working, and then it was the first year of the pandemic, and then there was a lot of pressure about the changing care system, and especially as a primary care doctor, for me, everything became virtual, and it was such a steep learning curve, and so much kind of palpable fear for everybody, the whole world at once. And so I was feeling so tired in that year, leading up to before I got sick. I was feeling like just crippling fatigue. By 7, 8 o'clock at night, I was ready for bed. But I kind of thought that was normal. Like after everything we'd been through, and every other doctor mom that I knew that had a few young kids, the fatigue just seemed like, well, yeah, everybody's tired. And so I didn't think I was special or that it was anything to be concerned about. Then I developed a cough, but I also had justifications for that. There were a bunch of wildfires in California. The air was bad. And so I just thought, well, maybe that's what's related. And it didn't register for me. And now it feels like the ultimate irony looking back, because I am a pretty strong internist and I'm really good at finding other people's cancer. Like whenever somebody would come to me with a new lump or bump, regardless of their age or how likely it was that they could have cancer, I always got that off the list of concerns as one of the first things. That was always sort of my practice, especially coming from a background in hospital medicine. I started as a hospitalist after my residency before I transitioned into outpatient care. And so it was always on my radar for everyone else. And so it felt like a huge slap in the face when I could not recognize my own cancer. So fatigue and cough, and then still wasn't hitting me, even though I would take long runs with my friends. I was kind of a marathon runner, and we'd do our 10-mile runs over the weekend, and he'd say, "What's up with you? You're like really tired and coughing." And I'm like, I don't know. I just thought I was getting out of shape and had a million excuses for why I was feeling badly. And then I got a lump above my left collarbone, a supraclavicular lymph node. And as soon as the lump came, then I knew, okay, I have cancer. Like it was, and it was because it was the constellation of symptoms, the cough, the fatigue, and the lump that was painless. It was growing very quickly. And then in the location, I kind of knew that it was probably something malignant. So, I told my doctor at the time, and I had rarely go to the doctor. I didn't have a need to go to the doctor. And so kind of started off with a thyroid ultrasound because it was sort of in my neck and it was unclear kind of where it was coming from. And I think we were kind of both collectively hoping that it was just a crazy big thyroid nodule or something, even though I was like, oh, it feels a little too over here to be a thyroid. But I sort of let that process unfold that way because I just was like still hoping that maybe there was a chance that this wasn't a cancer. And then the night where I got the ultrasound of my neck, the radiology tech said, well, your thyroid's fine, and then kind of sort of trailed off like that. And I said, but what? I'm a doctor, like, give it to me straight. She's like, well, I can't diagnose you with anything. But there's, she said, then there's these. And she pointed the probe kind of over a little bit to the side, and I could see these huge masses in my chest. And she said, those don't look good. Those look, like cancer maybe. But I can't diagnose you with anything. You need to follow up with your doctor. And so, I went home and I called my friend on the way home from work, and I was crying, and she works with me, and she ordered a chest x-ray for me. And so the following morning, which is a Friday morning, I walked into work, I got a chest x-ray, and then I went to my desk in my office and I pulled up my own chest x-ray, and I saw like masses all over my chest. And I just was shocked. And although I was like simultaneously expecting it and shocked, so strange to hold those things at the same time. And I walked into my friend's office right next door. She's a nurse practitioner. And I said, Mary, I think I have cancer. I just opened my chest x-ray and there's like masses all over my chest. And she said, what? And then I just kind of walked back to my office shocked. And then I closed the chart and I started seeing patients. And I think I saw like 20 to 25 patients that day, because for one more day, I could put it out of my mind that was some other lady's chest x-ray. Like, just let me live one more day in denial, focusing on other people, because I think my life is about to drastically change. And it did. So I think from there I got referred to a head and neck specialist. And my first conversation with the head and neck specialist, this is one of the very first experiences that kind of rocked my world on the patient end and kind of opened my eyes to the trauma that people start off their cancer experience with just getting diagnosed. Like even before they even start treatment, there's so much that happens for people that's super traumatic and kind of feels like the power dynamic is not equal, the playing field is not level. And one of the first experiences was when I was referred to a head and neck specialist and for biopsy of this lymph node. And the provider said, hey, I took a look at your scans and I think that this lymph node is too close to your carotid artery for me to safely biopsy. So I'm going to refer you to interventional radiology. And I said, okay, great. That makes sense. And somehow in my mind, with the way my chest x-ray looked and where the lymph nodes were and my age, I kind of already thought that I probably have lymphoma. And, but then the provider sort of went on to say after the first part, which seemed totally reasonable, like, I can't safely biopsy this. I'm going to refer to an interventional radiologist, and that's probably the better place to get biopsied. But that provider went on to say, I took a look over your scans and I saw something light up in your breast, and so I'm pretty sure you have metastatic breast or lung cancer, like that. And I just, I was like, what? Like, just the shock, like the blood all drained from my head. I started hearing this sound like, and like the lights were coming in and I'm like about to faint. And I really don't even remember what happened for the rest of the conversation. I went into trauma response because I knew that logically that didn't make sense. We didn't even have tissue yet. I also knew that I was still nursing my daughter, who had just turned 3. She was the one who nursed the longest, but I still had milk in my boobs. And when I looked over my own scan over the weekend, I saw the milk, and immediately I was like, oh, that's my milk. Like, crazy how it lights up like that. But I didn't even think anything about it. But this provider didn't know that history, and I don't know why they said that. I think sometimes, especially when you're a healthcare provider as a patient, like the way that people communicate with you might even be a little bit different. Like maybe if I was just a normal person, which I am, they wouldn't have sort of conjectured that way, but that's how it went down. But it was extremely traumatic. My brain immediately jumped to, oh my gosh, this is really scary. And I had these like thoughts of my kids, taking at my bedside, taking care of me in hospice. And that's sort of immediately where my brain jumped to, not knowing any of the in-between steps. And I was just kind of in a trauma space. I wasn't even thinking logically anymore. So my husband kind of took over for me and handled that, and then communicated with people at my office and said, we really need to get her biopsy quickly because she's going to have a nervous breakdown. So my coworkers really advocated for me, got me connected with interventional radiology. They biopsied my lymph node, and then it came back as Hodgkin's. So when it came back as Hodgkin's, everybody says that's like the cancer lottery. That's the good one. Like if you have to have cancer, this is the one to have. Ultimately, I found out there is no good cancer. Like they all suck, and just even the fear of cancer, like giving a shout out to people who are pre-vivers and haven't even experienced cancer yet, living with the fear and the knowledge that you could have cancer or you're at higher risk for cancer. Your life is just irrevocably different than it was before. And so anyway, I got diagnosed with Hodgkin's, and then I just thought, okay, kind of regrouped, and the pendulum swung back the other way, like, okay, death and dying. Okay, maybe it's just like a blip on the radar, just a speed bump. Got to go through 6 months of chemo and then check all the boxes. No big deal. And then I started the treatment regimen for Hodgkin's at the time, which is called ABVD. It's a 4-drug regimen, and it's a very intense chemotherapeutic regimen. And within 2 months, my health was wrecked. I went from like marathon running doctor mom to, just the pound, even though I was nauseated and vomiting all the time, the pounds just kept piling on from all the steroids I was taking, lost my hair, kind of was bald and bloated, developed pain everywhere. I had this feeling like I was sort of rotting from the inside out. It like chemo was just so, I don't know, just body rot, that's sort of how I describe it. And then trying to treat the symptoms of the pain of the chemo, I started off with 800 milligrams of ibuprofen 3 times a day. And then when that was giving me GI side effects, like a lot of stomach upset, then I started alternating with Tylenol, but then my liver was kind of inflamed. And so then I started with pain medicine, which is not really going to impact the stomach and the GI tract or the kidneys the same, but then I'm on pain medicine. And I was on pain medicine kind of throughout the last couple months of the treatment. And that was really hard. That's got its own set of problems and constipation and getting off of the pain medicine. But that treatment regimen was really tough. And I had a couple complications along the way. I got some lung inflammation with one of my chemotherapeutic drugs. And so when I communicated that with my healthcare team, like, hey, my cough went away from my initial diagnosis those first couple months, and now I'm getting a new cough. They realized early on that this is probably a bleomycin-related cough or a complication of one of my chemo drugs. So we dropped that one because there had just been a clinical trial. There had just been a trial published that talked about for people who do well on this drug regimen, and they get a PET scan after 2 months of therapy, you can kind of de-intensify the chemo regimen from 4 drugs down to 3 drugs. And I think that, I know people on here are all dealing with different cancers and stuff, but that concept is really important going forward, because I think in general, there is a trend toward de-intensification of therapy to get the least toxic therapy with the maximum amount of benefit for, tumor control and things like that, to help with quality of life and kind of thinking about the long-term toxicity that people face. And for me, it was like, I'm planning to live and I really want to get back to running. And so I can't have, severe lung damage. So we dropped that. And then I had kind of another complication where I had neutropenic fever and something called tiflitis, which is sort of a gut infection that has a 60% mortality rate. And I remember going to the emergency room and just think, and it was in the middle of COVID, so nobody could come with me. Nobody was allowed inside with me. And I made line buddies with somebody in the triage line, this woman who was Spanish speaking only, and I speak Spanish. And we were sort of communicating that we were there alone. And we were so afraid, and there were no chairs left. And so we kind of we just decided to lean against each other's backs to prop each other up, because we both felt like we were going to pass out. And then we developed this system to set a timer for every 3 minutes and trade off chairs in the waiting room. And I'm convinced that I didn't die in that waiting room because of that sweet woman. And I even said to people in the waiting room, a nurse walked by me and she was really busy. And I said, I'm really sorry. I'm not asking to go before any of these people, but I'm neutropenic right now. Is it okay to put me in a room away from everybody, because I'm really scared about getting sick? And this person kind of huffily said, you're just going to have to wait and get triaged. And sort of this really kind of nasty tone. And I know she was busy and dealing with so much. I mean, people are probably dying all over the place in the ER, but I just, I felt like I was just asking for so little. I wasn't asking to go ahead of anybody. I just was trying not to die of COVID or respiratory infection while my counts were so low. And I didn't feel like it was right to say, well, I'm a doctor that works here, put me in a room. I just didn't feel like it was fair to everybody else I was in line with. And so I didn't feel like I could speak up for myself. And I just, I'm collecting these moments the whole time going through my cancer treatment experience, thinking, oh my God, I feel so small and so scared. And is this how people feel all the time? Just going through this, it just, and I kept a notebook of all these different experiences. But I got through that. And then I got through the end of my treatment. And then I had a PET scan at the end of my treatment, and it showed no evidence of disease. But I felt so sick still. And so my oncologist at the time, she ended up leaving the organization where I work. And so my care was switched over to my oncologist now. But my oncologist at the time super sweet woman. She was so excited for me. She's like, "Are you going to Hawaii?" Like, yes, you're in remission. And I just was like, I'm thinking to myself, I'm not even sure I want to be alive anymore, like based on the way I feel now. Like life as I know it might never be the same. And I'm a shell of my former self. I had severe neuropsychiatric dysfunction, meaning like as soon as I could get off my supportive meds, like the opioids and the benzos, I came off right away, but it threw me into a massive depression. And I had really a lot of trouble stringing together words. Like I had word finding difficulties, carrying out lists of simple items, like go to the grocery store and get 5 items. It was hard for me to execute a task like that, to get 5 shopping items. I stopped driving at some point because I felt like I shouldn't be behind the wheel of a car right now based on how I'm feeling disoriented. And so, and I'm a doctor. And so I knew like, I wouldn't want a doctor like me. Like, so even though she was so happy for me, I was having trouble envisioning kind of what life might look like going forward. And there wasn't really anything for survivorship at that time. And so I just had this sinking feeling like that I'm not done with cancer and it's not done with me. And the first time I went through cancer, I went through as what I call the Goldilocks patient. I was like just wanting to behave and not make anybody feel uncomfortable with my cancer experience and do everything right and just sort of be polite. And then I just felt this sinking feeling like something's not right here. And within a month, I started developing symptoms of a possible relapse. I started getting the same left upper lobe wheezing that I had initially. And then I got a pea-sized lump up above my collarbone, and I knew that I was relapsing. And it took some time to get a PET scan. And then after getting the PET scan that showed a most likely relapse, I had to get 3 additional biopsies to confirm with tissue that I had relapsed. So I had a biopsy here, and it was kind of inconclusive. Like the people who did the biopsies were successful, and it was great, but they just kept coming back as sort of maybe, we're not sure. And then ultimately, I had to get a thoracic surgery, like to sample a lymph node right by my heart just to confirm the diagnosis. And I had never been under general anesthesia before, so the whole thing was just wild. But I also, so when I got diagnosed with that relapse and the pathology came back confirming that it was a Hodgkin's relapse, I just thought, okay, I think this cancer is trying to show me something. And that's sort of the narrative that I began in my head. That was my truth. I know everybody has their own thoughts and feelings about what cancer may represent in their life. But for me, I just thought, I think I'm supposed to do something with this. I think this is trying to show me something. I think I'm supposed to delve into my life a little bit further and look into, could this mean something? What are my beliefs about this? And so I started having this frame shift about what cancer was doing in my life at all, as opposed to like, I was a healthy marathon runner and how could this happen to me and things like that. Ultimately, I realized, sure, I was a vegetarian and I ate healthy, but I also had severe chronic toxic stress for years with my husband's stuff. I never got therapy for that. I just kept saying I was fine and kept working. Didn't get therapy for some real tough stuff in my childhood. There were a lot of things that I could do to address my health and well-being, aside from just eating what I thought was a healthy diet and jogging and obsessively working and caring for other people the way that I needed to be cared for. So I started seeing like, okay, this cancer is doing something different in my life. It's showing me some ways that I need to heal myself. And so then I started the road to transplant, which was 3 months of targeted therapy. And then I had to mobilize my stem cells because I was going to be my own donor for bone marrow transplant, for autologous bone marrow transplant. So I mobilized my stem cells the old-fashioned way with cyclophosphamide and something called GCSF. Most times now, people who are donating their cells to themselves, they just do the shots of GCSF to stimulate their marrow. But there was a question on one of my scans about whether or not I was in a complete remission, because I had had a cold recently, so they weren't sure, are these lymph nodes related to a cold, or are you in a complete remission? So they decided to use one more slug of chemo, like a big slug of chemo, and collect my stem cells that way, because that's sort of the way they used to do it. And that might also treat any amount of residual disease that they were seeing on the PET scan. Because it's important in the bone marrow transplant world that you go into your bone marrow transplant in as deep of a remission as possible, because that has to do with your likelihood of subsequent, remission and relapse and things like that. So got the cyclophosphamide, and it worked. Did great with my stem cell mobilization, and then I started peeing blood. And so I had this sort of classic complication from cyclophosphamide called hemorrhagic cystitis. Oh my God, it was so awful. It's not just blood, but it's blood clots. And so it's like passing kidney stones over and over and over again. I told my friends and my husband that it felt like every urination was like crowning a baby, that was how much discomfort it was in. And yeah, it was so hard. I required a lot of pain medicine to get through that leading up to my transplant. So then I went into my transplant and I'm back on the pain medicine that I tried, so hard to get off of. And yeah, so then and it sort of cleared up right as I went into my transplant. But then during transplant, for the first 7 days, for me at least, you get your conditioning chemo, which is sort of what the transplant is for. Like, your stem cells are there to rescue you so that you can get really, really strong chemo that's treating your cancer. Like, they're able to give like 10 times the strength of what they would usually give, basically what would be otherwise lethal doses. And that's why you need your own stem cells back, to rescue your marrow from the strength of the treatment that you're given. And so the first drug that I got basically just flared up my hemorrhagic cystitis again within the first day. And I'm like, oh my God, buckle up. Like, buckle up, Buttercup. This is about to be rough. So then I got those drugs, and gosh, the BMT nurses are freaking amazing. Like, I mean, I think all oncologic providers hold a special place in my heart, but even within the onc world, BMT nurses just see the sickest of the sick, and they just know such incredible ways to take care of patients beyond just like, what are the meds they can get? They'll say, oh, put a cold rag to the back of your head this way, or smell this, it'll help with the nausea. And the care was just incredible. And the last drug that I got in my conditioning regimen was called Melphalan. And it was sort of, they're moving away from the regimen that I got called Beam, because it's a really intense regimen and there's sort of less toxicity with the newer regimens. But the newer regimens contain cyclophosphamide, which had just caused me to pee a bunch of blood. So they didn't want me to get that regimen. So they used this old regimen called Beam. And Melphalan is basically, I think it's the devil. It's just the horror. It's like this super hard drug. And I'm amazed. I have other friends that have been transplanted that did not have as tough of an experience like I had. And I'm in total awe of that, because for me, it was really hard. So yeah, I say that basically after I had Melphalan, within a day or two, I felt like I was starting to slip away. I went to this place sort of spiritually, metaphysically, that I call the in-between. I was just so close to my death. I could feel it. I felt like somebody just had to go, or like, flick me like that. And then I'd be gone. And I kept having this visual, when I was in that space, of the light shining through the trees, when you're sort of in the park or in a forest and like beams of light are coming in. And I kept seeing that vision. And I was drawing it and I was painting it, because I felt that, I wasn't just seeing that in that space. I felt I was becoming that like energetically, that's where I would go next. And that felt like a very real feeling for me in that moment. And so, and I just feeling so close up to my death like that, I was like right there. And I just thought, oh my gosh, I wasted so much time in my life, like sort of living out somebody else's script of what my life should be and not my own, and just trying to people please, and like the emails and traffic and all this stuff that we really think matters, and it like doesn't matter. For me in that moment when I was right up there with the possibility of all of it ending, I just felt like it's love. Like it's love. That's for me, I felt like that's why we're here. Just love and connection. And I just completely let go. I surrendered in that moment. I just thought, if I am lucky enough to get back to that life, I may never be a doctor again. And maybe that's okay. You know, I can just be Sam. I could just be a mom and a wife and a community member and just a good person, like bringing light to other people. And I might never get back to medicine. And finally, for the first time in my life, I was okay with that. Like, my self-acceptance of just who I am, completely separate from my accomplishments and what I had, felt so real. It was like a reset, you know, my second chance. And then I started like regaining substance. My stem cells started engrafting, my counts were climbing up, and I started like coming back. And I thought, oh my gosh, here we go. Like I got this second chance. And so, then I went home and continued healing from my transplant, and I was still a wreck. It was very hard physically, nausea, vomiting at home. My husband was caregiving for me along with our 3 kids at that time. And I just want to give a shout out to caregivers and the importance of recognizing the people around the patient, and the importance of including them and taking care of them as part of taking care of the patient. Because he was driving back and forth to Stanford, you know, which is a 3-hour drive from where we live, all the kids, the dog, taking care of me. I mean, I'm pretty much bedbound for a month or so. And it was so hard on him. And I think a lot of people are going through these caregiving experiences where they're just doing so much. And so around that time, speaking of caregiving and with the kids and everything, our kids went to Camp Kesem, which is a camp. I see heads nodding. It's a camp for kids who've been impacted by a loved one's cancer. It could be their parent or whoever's raising them. And it's free, a 5-day sleepaway camp where basically the shared experience of the commonality is that, you know, kids have someone around them in their first close personal life that have been impacted by cancer. Yeah. And it was so incredible. I realized that the importance of that, and part of managing my fear about my mortality, about fear of cancer recurrence, about just living and moving forward, was helping them with their fear, because seeing the looks on their faces and how afraid they were about how poorly I was doing and how I looked was such a trigger for me. So then I realized the importance of how much we need to care for the people around the patient, in order to provide the patient a better experience too. It's all kind of this connected thing, and it's so much bigger than just chemosurgery, radiation. Like, it's managing the emotional experience, the family, the financials, all of it. So I'm kind of having all these realizations, and I'm having a really tough time. Right after the transplant, I'm getting off again the pain meds and the nausea meds, which included Ativan. I came home from the hospital on 1 milligram of Ativan Q6 hours, which is 4 times a day, which is pretty standard dosing for nausea. And I was so grateful to have that when I needed it. But getting off benzos and opioids sucks. It's so hard. And I don't feel that I struggled with addiction or misuse. I used it exactly as prescribed, and still coming off of it, felt like it was going to break my brain. And so I wrote that down, and I asked my friends who were in medicine in the group that I work, I was like, what do we have for this experience? Like, what are we doing for this? And people said nothing. We're not doing anything. And I said, well, this is a major problem, because if I had this hard of a time, I knew what was happening to my brain as a doctor and the sadness that I was feeling. And I knew that it was a chemical shift and that I just had to hang on. And in a month or two, it would be better and it would go away. But I had thoughts like, gosh, I could really see somebody throwing themselves off a bridge over something like this. Like, that's the level of despondency and just chemical dysfunction that my brain felt for about 4 weeks. So wrote that down as a care gap. And so when I was sort of in the pit of my despair, I kind of learned about this word survivorship. And I was like, oh, what's that? And somebody mentioned something about a support group. And so I joined a blood cancer support group. I had not been a support group person in my life leading up to this, because I had all these misconceptions about what support groups are. I thought, oh, it's kind of this really sad thing, and everybody just sort of talks about like how horrible they feel, and like I don't need that. That's not me. And the first time I got on this blood cancer support group, I saw the heads nodding like this. And I just was like, oh my God, I felt seen. Like, these are my people. And sure, we talk about this hurts and that hurts, but the majority of it is like the amazing things that we're doing despite these diagnoses that we have, and how we're finding the light, and how we're figuring out how to live in the face of these challenges. And, oh, your doctor mentioned that to you? That sounds like a good idea. Nobody said anything about that to me. Maybe I should try that, or ask my doctor about it. The sharing of really valuable medical information. Like, I learned a lot of things from other patients and family members that I never heard from my doctors. And so I was like, yes, totally. I was like, oh my God, these people know a lot. And then in that group, I met my best friend for the year after that. And she passed away in May this year. She's had a really tough lymphoma leukemia kind of hybrid, and kept learning her treatments and whatnot. But she kind of showed me what is possible in cancer. She was only in remission maybe 5 to 7 days in the whole year that I knew her and was friends with her. But she was one of the most alive people that I have ever met up until the very end. She stayed connected with people. She had such vitality and the humor. And so it kind of opened my eyes as a doctor, like thinking about the survivorship stuff. I kept telling my doctor, like, oh, I'm interested in survivorship. And then she would show me the NCCN guidelines and things like that, which talk a lot about surveillance. And I just thought, that's not really what I'm talking about. Like, it's part of what I'm talking about, but survivorship is like this approach to how do you live after a cancer diagnosis. And it includes, of course, surveillance for relapses and recurrences and second cancers and complications from treatment. But maybe it's also about all of the other things that I was experiencing, like the psychological aspect, the spiritual aspect, the family. Like, maybe it's okay to talk about death and dying from the beginning, and not put it off till the very end, because that's the lived experience. Like, we keep applying this very linear thinking to cancer and to survivorship. That is not the lived experience. Like, anybody who gets diagnosed with cancer can tell you one of the first things they think about is death and dying and getting their affairs in order, and fear and what might that be like. And so I think by putting that conversation off until later, and just sort of, that it's this huge missed opportunity to allow people to talk and process their death while also planning for life. Like, they're not mutually exclusive. And I think the medical approach currently, there's obviously some exceptions to this, but it seemed like it was this very like linear kind of mechanistic, no, that's in that box over there, and this is in this box over here. And I'm like, hey guys, I've been collecting insider intel in the cancer space in the last 2.5 years, and this is not what people are saying. And so anyway, my friend showed me that vitality is possible at every stage. And she said things to me like, Sam, I just want to be fully alive until I'm not. And she also said, they're treating me like I'm already gone, but I'm still here. And what she meant by that was she talked a lot about sex and sexuality, and how one time she was in the hospital and somebody mentioned something about stopping her hormones, um, and she said, wait, I need those. And the provider said, like, well, they said this really funny thing, like, are you sexually active? They asked about it in a very specific way. And she said the look that washed over that person's face when she said that she was still physically intimate was so additionally painful on top of her terminal diagnosis that she was experiencing, because this person clearly couldn't process that she could want to have or be capable of having this level of physical intimacy while also having terminal cancer, what they thought was terminal cancer. And she told me how additionally painful that was. And I was like, we can do better. We could do better with that. So I started going to survivorship meetings at the organization where I work with, and I would notice people saying things like, oh, we don't talk about sexuality and survivorship. Of course, we'll wait to talk about that until after, till people are like in the clear or whatever. And I just thought, well, why? Why are we doing, And it didn't make sense, some of the things that people were saying. And I started gathering a little bit of strength and a little bit of confidence in noticing these gaps in what people were saying or how care was being delivered and what I experienced and what so many of my friends and other members in the cancer community are experiencing, and thinking like there is something to do about all of this. Mm-hmm. And I think there's an opportunity to sort of completely overhaul the cancer survivorship care system. So meanwhile, I'm having these realizations and going to these meetings, and I'm continuing to get my targeted therapy. I got a whole year of targeted therapy after my bone marrow transplant. Just finished that in June. And I'm in remission now. And it's still a road. I'm still dealing with things emotionally, psychologically. I'm doing much better. I have gotten therapy at this point. I have a lot of support in my community. I am really privileged. But it's still hard. My feet, I have all kinds of problems with neuropathy and sleep, and just, I had to heal myself metabolically from, I was almost diabetic, had liver inflammation from my treatments, and I had to really lean into integrative therapies. I did fasting and juicing and like all these, supplements and acupuncture and like dancing and art as a way to heal my brain. I realized that when I was just sitting at my desk and looking at my computer and my books and willing myself to just think harder, like just think, Samantha, with all these lists, that was not working. And I just, but once I started doing things more artistically, like a friend told me, I didn't find this out from my healthcare team, but a friend said, you need to work with your hands, like use clay, do painting, music, dance. So I started doing all these things, and lo and behold, my brain started healing. I began to be able to think again by just kind of doing these different, almost like occupational therapies, different healing modalities. Mm-hmm. So I learned the importance of those things. And so now I am trying to build a cancer survivorship system that is basically houses all of this. Like, this is my dream vision. I noticed that everybody defines cancer survivorship as anybody living after a cancer diagnosis, but then that's not the way that it's practiced. At least in the healthcare system where I work, survivorship tends to be heavily focused on one or two cancers. There's a lot of breast because it's sort of the largest need, and a lot of the people are impacted by that. And there's a lot of money for that as well. And it's focused on after active treatment is finished. And so that was one of my major light bulb moments, like, hey guys, I think this is actually kind of crazy for two main reasons. One is that there are so many tools in what I think survivorship is, the psychological tools, the sort of dietary tools that are important for cardiovascular health, because even if people survive their cancers, they are more, at risk for accelerated aging and cardiovascular disease. And so the sooner we can talk to people about how to manage their new bodies, the better, and like really real conversations about what they're about to go through. So all these tools that we're only talking to people about after active treatment would be really helpful if we started introducing those on the front end, and also more than once, because it's going to take more than one visit for people to learn this information. It's like there needs to be repetition built into this process and this model. And then the other thing is that, what about all the people diagnosed at stage 3 or stage 4 who may never have an NED scan, but they're going to be long-term survivors or thrivers, or however they refer to themselves? They're going to be long-term survivors on active treatment, but there will never be an after active treatment. But they might survive like a decade or more now at this point with all the incredible drugs that we have. And so our ability to take care of all the lives that we are saving, has not kept up pace with how active treatments are being able to prolong people's lives. And so I don't know that we kind of thought about that or predicted that or kind of planned for that. Right now, there's like 18 million cancer survivors, and in the next 10 years, there's expected to be like 24 million. So our population is expected to grow, and yet there's not enough oncologists in training to take care of all these people. And primary care doctors right now don't receive any training in how to take care of cancer survivors. And so, I'm really trying to build a system that basically would be this longitudinal model of kind of walking with the patient through their cancer experience, starting from diagnosis. And it would be sort of this shared model. And not only do I think that people will have a better, kind of less distressed cancer experience by talking with somebody who can speak to all of this and kind of knows what they're going through, but I think that oncologists might feel less burned out by getting support for their care and working in care teams with somebody who can really kind of help them. And I see allied healthcare providers as having a huge role in this. And that means like nurse practitioners, nurses, physician's assistants, health educators, social workers, dietitians, PTOT, all as part of a really good survivorship program. So I learned all this, had these realizations, and then just since January this year, I've been connecting with all these people all over the country, including One Cancer Place, and people all over the world who have been trying to do survivorship for decades. And just trying to figure out where are the problems. The business case for survivorship is really hard. So a lot of people get it ethically. They're like, that's amazing, sounds super good and crunchy, and it's the right thing to do. But is it going to save us money in the cents and dollars? And so that is a tough conversation that I keep kind of running into, and sort of one of the realities of the situation, at least in delivering it in this country in the way that I envision it. But I think it is financially a really good model as well, because I think that when people get the right care up front, there'll be less emergency room utilization, there'll be less kind of distress when people understand what's going to happen to their bodies, who to go to for what things. So it's just a matter of being able to show that to the people who are holding the power to sort of let us have a system like this. So
the preventative measures would be so much more important than preventing some of this stuff, or catching it early would be so much better than if we could do some of that. It'd be wonderful.
Yeah.
Yes.
And I just realized the importance of sharing beliefs about the cancer experience. So I talked at some point, I've been rambling for a long time now, and I apologize for that, but I talked about how I began to believe that cancer came into my life to try and show me something. And at some point, when I was having some communication friction with my new oncologist who came on right as I was relapsing, I realized, why does this person keep thinking that I'm so anxious? I think I need to tell her what's happened to me in my life, and that maybe she'll understand me in the context of my life a little bit better, and that will help us to communicate so that I get what I need, and And then she knows how to care for me in the best way possible. Like, and I think that what I mean by that is that sometimes I think we need to tell doctors or healthcare providers how they need to doctor for us. Some people want to know everything. Some people don't want to know anything. They want you to talk to their person, their significant other, or their family. I needed my doctor to know that I believe, my underlying belief is that my severe chronic toxic stress and kind of burnout and not processing things and people pleasing and all of this, I feel like it helps contribute to the conditions in my body that made it a little bit easier for cancer to happen. And that if I'm going to stand any kind of chance going forward, that managing the mental, psychological, mind, body, spirit has got to be part of this experience, in addition to my evidence-based targeted therapy and all this other stuff. Like, they're not mutually exclusive. And I'm not telling people to just meditate and not get their treatments. Like, I just think I think people need the whole menu of options. Here are the allopathic things. And also here's some other things you can do that may help you suffer a little bit less, may impact the outcome, may make you live a little bit longer. But even if you don't live longer, maybe for what life you do have, you'll be able to fully live it and feel less distress. And as soon as I shared with her about the stress that I was having and what I think cancer represented in my life and my story, she was like, oh yeah, that makes a lot of sense. I agree with you. I think managing your stress is really important, and it's a huge part of your story. And so then she encouraged me to apply for ASCO Voices, where I had no idea what a huge conference it was. That was crazy. So I applied to speak, and I got to speak, and then things kind of really took off from there and just started making all these connections. And so she became my biggest champion when I had kind of the courage to share with her my deepest, darkest personal belief. She validated it, and she encouraged me to tell my story, and that became part of the medicine. And then subsequently, I saw her, she seemed to be different. And she told me that in caring for me, caring for my friend who had passed away, that she almost felt like it made her more spiritual. Like there was this other element to providing care. Like she seemed kind of less tired and burnt out. I think getting to connect with people on this level, in addition to the medicine or as part of the medicine, was improving her experience, which I think then improves the patient experience. So yeah, it's all connected. And I'm just really grateful that I'm still alive to explore all of this and to meet all of you. So enough of my
No, this
talking.
has been it's wonderful. You're such an inspiration, and hearing your story and especially from the patient doctor aspect is really something else. It's just incredible. Janet and Stephen and we have Danny here too, I think. Do you guys have some questions for Sam at all that you guys been thinking about?
Okay. I'm just curious as to when you actually stopped working. When did that happen for you?
Yeah, I stopped working pretty much right after my diagnosis. I think I worked maybe 1 week after, like in between when I got my port and then started treatment, because I told my doctor that I wanted to keep working, my first one, and she's like, ha ha ha, I don't think that's a good idea, Mm-hmm. But then I actually, once my brain recovered after my first round of treatment, before I went into transplant, I did work for a couple months in there remotely. I did some kind of virtual coverage when I felt that I was able to. I always felt that it was really important to check in with myself, like cognitively, am I up for the task? And then after my transplant, I didn't work for 6 months, and I started working in January of this year. And I'm still like a fraction of what my usual workload is. I'm building up to it. I am improving in the complexity of the things that I'm able to do, like mentally and physically, like problem solving, multitasking. But I peter out at like 4 to 6 hours. So my stamina to be able to do really complex cognitive stuff is not at my baseline yet. So I do feel like I have good medical decision making, all these checks and balances. I trust where I'm at and all that. But I just, after about 4 to 6 hours, I noticed like, okay, I'm having trouble paying attention. I really need a nap. Everything hurts. So yeah, I'm still recovering, but I've been working since January this year, and my hope is that. So I'm also restarted all my childhood vaccinations after my bone marrow transplant. You have to start over. So my hope is that by time I'm able to get back in the clinic, that I am only practicing survivorship primary care. So being a primary care provider for cancer survivors. So that's sort of what I'm in the process of trying to work out right now with my organization. And so we'll see. I don't know.
Funny that you say that. Actually, my brother-in-law is a doctor, and I just moved, and I'm still have all, like, my primary is in Philadelphia, and I said, oh, I need to get a new primary. And he said, well, I think you should go to a boutique doctor, and I think that you should really talk, maybe to your oncologist and see if they can. Maybe MSK has a specialty department for special doctors for survivorship and I said, well, I'm not sick. And he started laughing. I said, I don't have anything wrong except cancer. And he's like, yeah, but it's very complicated. And obviously from, all the chemo and all the surgeries and all the things that your body has been through, you're a much more complicated case than just an quote normal person, let's say, or a normal patient. Are there primary care physicians that are specifically for surviving cancer patients?
I love this question. I'm hoping that there are, and I'm hoping that we'll continue to train a workforce. There is not one agreed upon model at this point. So different cancer centers and different places do it differently. MSK, I think, may have a comprehensive survivorship program. That's what I've heard, at least at some point they did. But survivorship care is sometimes delivered by an oncologist. Sometimes it's delivered by a primary care doctor if a patient has like a survivorship care plan. Like the oncologist or the oncology care team will sort of write out what are the things that a patient needs going forward in terms of subsequent screenings and things like that. Sometimes it's primary care. Sometimes it's oncology. Sometimes it can be like a nurse practitioner or a PA that practices in conjunction with one of those. I think the main thing is just asking whoever's taking care of you, if it's not a formal survivorship practice, is do you have any experience caring for cancer survivors? Because it is really everything that you said and that your brother said is absolutely true. It's somebody who needs to be attuned to monitoring you for relapses, recurrences, or progression, second cancers that can occur as a result of the treatment that you had for your first cancer. Like for lymphoma, a lot of the chemotherapy that we're given actually increases the risk of something called MDS, myelodysplastic syndrome, and leukemia later on. Not super high, but it's there. And so if like our blood cells are changing on our CBC, we need somebody who can say, hey, the cells are getting bigger. You might be headed toward this thing. And at some point, we should refer you to a hematologist. You need somebody who knows, like based on your treatment, if you had radiation or whatever, should you be having should you be having population-based screening, based on your cancer? So, for instance, like for someone who's had prostate cancer, and they've also had like pelvic radiation, instead of having a stool test or fecal immunohistochemical staining or FIT, like the yearly poop test, should those people be getting colonoscopies and not the stool test? And so I'm not saying that a survivorship person has all the answers, but at least they know to ask the question. And I think that's the most important thing, is like connecting with somebody who realizes that cancer survivors are not the same as the general population. Even if you look okay and you seem healthy and all your organs are okay, based on the treatment that you've been through, you just need somebody who is going to be really honest about, somebody came, a survivor came to me with a new lump or bump or a spot on their skin, kind of just this really knee-jerk reassurance, like it's probably okay, no big deal, is maybe not appropriate for a cancer survivor as compared to a otherwise young and healthy adult who hasn't had cancer. Like there should be a lower threshold for working things up, getting tests. And so, yeah, I think somebody who's just, who's more attuned to those things.
Thank you so much. Really help. I'm also glad to see that you're doing so well. It really is such from one cancer patient to another cancer patient. That's all we really want to see is everybody thriving and doing so well. It's really heart explosive.
Oh my gosh, I feel the same way, like total heart glow right now. Thank you.
You brought a lot of things up for me. I have one question. Do you see receptivity to survivorship practice, medicine, integration, whatever you want to call it, in the UK, the EU, or in Australia? Do you see that? Can you look at it internationally?
Yes. In fact, I think Australia is a little bit ahead of the curve compared to where we are. There's a guy. Yeah, go ahead. I'm sorry.
My husband used to, not just on cancer, on just like everything. He used to always be amazed at how Australia was. Sometimes they had, people didn't sometimes have the big menu of choices like we have in America, but they were very research based. They were and they had sometimes those bigger ideas. So that doesn't necessarily surprise me.
I just went to this cancer survivorship research symposium at Stanford in September, and there were people from all over the world, and there were a lot of Australians there, actually.
Yeah. So that's quite a group. So are you familiar with Gabor Mate? So have you read this book?
I have not read that one.
Okay. Because he actually talks about people who, because he's very into trauma-informed care.
Yeah.
And so then he talks about how people who often have had that chronic trauma sometimes can be more likely to have not just cancer, but other chronic diseases that onset early. And some of the things he said about, especially MS, were pretty interesting to me too. So it goes with that same thing. So my son was 25 at diagnosis. And so they spent a lot of time. So when you were talking about sexuality, that's what popped into my head. They were very comfortable talking about fertility. What can we do to, freeze sperm, do this, do that, and, but I don't know that they talked as freely about sexuality. And so, and I don't know. I just think some people are going to be more comfortable with that than others. But you're right; it's just part of the human experience. And I hear a lot of caregivers say, "Oh, I just miss that part of our lives." So
I'm so glad you brought that up, because I actually did a podcast recently where I talked about intimacy and cancer. And I was talking about that I have a couple of friends in the leukemia lymphoma world who have always known that they didn't want to have kids. And when they brought up sexuality, it was immediately conflated with fertility.
Yeah.
And that was really offensive and triggering for them. And in fact, a couple of them had said that they were forced into reproductive consults, even though before they were able to start treatment with active leukemia. Yeah. And they were like, I know I don't want to have kids. Like, why are you forcing this on me? And so it's tough. I mean, sometimes I think, I don't know if it's driven like medical legally, if it's something that's required, or what it is exactly. But those are not one and the same for everybody. For some people, their fertility is heavily tied to their sexuality, but for a lot of people, it's not. So I'm.
I think for the for the oncology providers. So because my son was 25 at diagnosis, he got a visit from somebody from their adolescent and young adult program, and that was her. She offered him contact with support groups, and she offered him, information about preserving his fertility, and he was having a really rough early. And it's literally easier for guys than it is girls, of course. I mean, if you're trying to preserve fertility in a man, it's a matter of freezing sperm.
Yeah.
In women, it's a lot more complicated than that.
Mhm.
And a lot more involved.
Yeah.
And so I agree. If I said, no, I made that decision a while back now, I'm not going to have kids. And they're like, well, we really want to see you, have you see this GYN person? I'd be saying, a part of no, didn't you get? But, and so, it's an interesting thing, but yeah. And I saw my son just kind of shut that relationship part of himself down, that like boy girl, having any kind of I saw him really shut himself down, even though I couldn't see him because he was in Cleveland and I was and I knew it was happening, just because that's a really hard moment. And the death and dying, I thought that was really good. I listened to a podcast, and you're probably a podcast listener to a degree too. I listened to a podcast called Jerry Powell, and it is out of California too. And they're talking about geriatrics and palliative care. And I just listened to a really, really, really interesting podcast about POLST, POLST, that procedure. Yeah. And you could tell that, especially among palliative care doctors, there's kind of some burnout in having this checkbox on their quality control sheet that says you must talk about advanced directives and POLST and all this other stuff. And because actually POLST is a lot like sex. You start a conversation and the person may look at you blankly and not be ready for that conversation. But then, flash forward 3 to 6 months down the line, they know you're open to having that conversation. And so then it comes back around. But it is really astounding how many people are not. They're not. I think that people do think about it. I think patients think about it, families think about it, and they have trouble having the conversations. So that's a very interesting thing to me, where people are and how you facilitate that. And I just always talked to Gavin and said, basically, I want to do what you want to do. I want to do what you want to do, but it's very difficult. And even though I didn't talk to Gavin about financial planning, because at that time he didn't own anything except computers. But I did talk to our financial advisor, and I said, what needs to be in place? And he said, be sure that you're on his checking account. And that was a simple thing that we did that made it easier going forward. But for people that have a lot more complicated financial affairs than that, so many people would benefit from actually being able to talk to a financial planner or a lawyer, and they don't think they can afford it,
Yeah.
Or they don't want to talk about it, So I think there's a portion of patients that just don't want to deal with it, and they just don't want to go there.
Well, I'll tell you what, when we first did financial planning, nobody in the household had cancer. It wasn't even but it's still very grueling, just to get all the information together, to fill in all the blanks that the person tells you that you need to fill in. It's grueling.
Mm-hmm.
Samantha, do you have your own podcast?
No, I don't.
What was the podcast that you were just on?
It was for this organization, this nonprofit called the Wellness Within.
Wellness Within.
Yeah, Wellness Within. I think I posted it on my LinkedIn page. I'm fairly new to social media. I really held off long on that one. But after this Stanford Survivorship Conference, so many people said, "Are you on LinkedIn? Are you on LinkedIn?" And I thought, I think this LinkedIn thing is a thing. And professionally, I don't want to miss out. And so I better get on this thing. And I'm so glad I did, because that's where I met Erica and Gina and now all of you guys.
I'm going to check
it out.
Yeah.
You're not on Facebook at all?
No. My joke for years was I could barely handle my real life, let alone a cyber life,
I was just wondering, just because that's where we have a lot of our discussions events, and that kind of thing.
Yeah.
And we have a private group on there. And So it's very closed as far as not
But
being all, you know.
I mean, I feel like because Erica keeps telling me I need to do more with LinkedIn, and I'm like, ugh,
Yeah.
it just becomes another thing on your to-do list, and if you're not. So I would say if you're more fiery about LinkedIn, you should put your energy there. That's what I think you should do.
I have so much passion for this area, and like I know strongly like that this is my ikigai. I just learned that word. I love that word. It's sort of like this convergence of what the world needs, what you're good at, what you can make a living doing, your sort of passion, purpose. And so I really feel strongly about that. And I'm also very realistic. I'm a cancer survivor. Like, this body does not do what it once did, and I have to like really be careful with myself about overworking and burning out and doing too much. And that's a daily conversation I'm still having with myself. And so, I'm just, I'm trying to be realistic about what I can do and how I can stay present with my kids and my family and stuff. And I don't know that I'm that skilled that I could handle all that.
No, it's true.
So,
what are the ages of your kids now?
They're 10, almost 12 and 5.
Oh,
yeah.
Wow.
And it was hard through the experience having littles like that. But I also think it was like they were a total gift. Like, when I was in the in-between during my transplant, they were my anchor. They're what held me here. I was just thinking about their faces and just like, God, I really want to watch them grow up. Like, I really want to be there. Really want to be there. But it's tough. I still feel guilty for everything. I was just cooking dinner the other day in the kitchen and like looking at the kids, thinking how much older everybody looked than when I first got diagnosed, and feeling like really guilty about everything that they've been put through. And yet all the conversations that we've had in order to deal with this, and like Camp Kesem and all this stuff, the community, they're like extremely resilient, emotionally mature human beings. And they're funny. Like, even despite they're not all sad and, bummed out, like they're so resilient. And so they've been a really good mirror to me about like how to live. And when I get too in my head, my daughter's like, Mommy, color with me. And I do. And so I don't know, I just kind of, it's sort of like I try and do what my dog is doing, like live like my dog. And I'm also trying to live like my kids and my dog. They seem to have it figured out.
Live in the moment. That's the best you can do. Live for today. That's it, Yep. Live for today. Yeah. Oh, this was great, you guys. Oh, thank you so much, Sam.
Yeah.
Anybody have anything further that they want to talk?
Thank you so much. You are truly an inspiration, and you have great energy, and you should let that shine, because you will touch a lot of people.
Thank you. I'm so glad, like the cancer survivors, thrivers, all the people in this community. Steve, we got to chat last week when we had this quick, this quick attempt that didn't work out. We were having some glitching last week, but you and I got to talk. But people like yourself, Danielle, Janet, I mean, you guys really, you help me with my energy. Like, I have to use my career and like where I'm situated in medicine and in my life, my privilege, to make it better for all of us. And I draw in a lot of my energy from these conversations with you guys. So.
Well, thank you.
Yeah.
All right.
Thank you so much for your time.
Sam. All right. Yeah.
It's been wonderful.
It has been. Thanks for showing up today.
Oh, no, thank you. Thanks for everybody for coming back.
Yeah.
It's great.
This is the first time I made it. So,
good.
Yes,
all right.
That's right. All right.
All right, you guys. Have a great rest of your day.
All right. Bye.
Thank you, Gina. Bye-bye.
Bye. Thank you.